So we are the biggest center in this country for cadaveric organ transplantation, and so far in the last 3 to 4 years we have done more than 250 liver transplants from cadaver organs, in addition to the living donor liver transplants. Our success results are exemplary, and we have got more than 90% success results, which are at par or even better than most of the advanced centers in the world. Patients from all over the country, they come here to get transplanted through cadaver organs. These are the patients with liver failure, or sometimes more than one organ failures like livers and kidney failures, and they do not have any hope of cure without a cadaver organ, especially since if they don't have a living donor or anybody in the family to donate to them. So these are the people who come here and get the benefit of an organ transplant. The biggest challenge as far as cadaver donation, cadaver transplant is concerned, is one, to the availability of the cadaver organs, that is so poor that among all the people who come here, probably only half of them get lucky enough to get a cadaver liver. Half of them unfortunately are never able to make it to a transplant. That being said, the coordination or the logistics which are involved in a cadaver transplant, they play a major role in deciding whether this whole endeavor becomes a success. When a cadaver organ becomes available, when a potential donor whose brain dead is notified, then the whole thing of trying to get a recipient in time, the recipient should be fit enough to undergo a transplant. The organs have to be retrieved and transplanted in a stipulated time, or in a limited time period. All these things, the logistics around it, many a times we have to retrieve organs in a different city. We have to fly through commercial airlines. So all these are the logistics which have to be coordinated in a manner which is conducive to a preferable or a good transplant outcome. This is the main challenge as far as cadaver transplantation is concerned. The big advantage of cadaver transplant is when we are dealing with people with failure of more than one organs. We have now done a good number of patients who have had dual transplants, in the sense they have had liver and kidney failure, so they got both the organs from a single cadaver. This helps them become completely healthy. Trying to do this through a living donor means that we will have to take two organs from two different donors, which makes it very cumbersome and complicated. So that is other thing is pancreas, right? I have to speak about pancreas. But the other advantage of sorry, you can edit this part out, right? Pancreas transplantation again is done worldwide through cadaver organs. Pancreas is an organ which is vital to making insulin and vital to controlling the sugars in the body. People who are long-term diabetics, they end up having kidney failure as a result of diabetes, and giving them a kidney transplant, for example, is going to cure them of the kidney failure, but this kidney again gets exposed to the same bad effects of diabetes. Giving a kidney and a pancreas together leads to a situation wherein the diabetes is cured and the new kidney does not get affected by diabetes and has a survival which is better as compared to people who would have a kidney transplant alone without a pancreas. Also, a lot of other complications of diabetes like neuropathy, like retinopathy, people who have got nerve problems like autonomic neuropathy, these are the problems which will actually get stalled, or they will not progress any further if we end up doing a pancreas transplant. This is the big advantage of cadaver transplantation. It should be okay. One advantage whenever we do we have to understand that whenever people get transplanted with more than one organs, actually the medicines that have to be taken in, as far as the immunosuppression is concerned, remains the same. So there is no additional immunosuppression just because you have got a kidney in addition to a pancreas, or a kidney in addition to a liver. The immunosuppression remains the same, the medicine remains the same, and the benefit actually doubles. So that is one big advantage of doing multiple organ transplant in people, obviously in people who would actually need it.